Hi mamas, my name is Sammy from Body and Birth Physiotherapy in Paddington, and I just wanted to share with you today a little more about what we do as women's health and pelvic floor physiotherapists and how we can help you during the unique time that is pregnancy and postpartum. Your entire body, including your pelvic floor and core muscles, are going through some pretty incredible changes during this time. The pressures of an ever-growing baby, you're changing hormones, childbirth, and then caring for a child that just keeps on getting heavier places new physical challenges on your body, some of which can lead to some long-term changes. Some of the most common concerns that mamas come to see us for at Body and Birth are to prepare for pregnancy and childbirth, so getting a lot of education on how to protect the pelvic floor and core muscles during this time. Guidance around safe exercise during pregnancy or afterwards so as not to do any harm to those key muscles. Abdominal separation or diastasis. So during pregnancy we can chat about strategies how to minimize the strain through the abdominal wall, and then postpartum how to restore the function and closure to those core muscles. Any bladder and bowel issues, so things like bladder leakage with coughing, sneezing, laughing, exercise, urgency of the bladder, needing to rush to the toilet, bowel challenges, so tricky emptying of the bowels, constipation, or trouble controlling the bowels or wind. Prolapse is another common concern that women come to see us for, and it's often characterized by a sensation of heaviness or bulging into the vagina, or the feeling of a tampon just not quite sitting in the right spot, which can be a bit irritating. Painful sex or pain within the pelvis or the pelvic floor muscles is another concern that might be new, postpartum, or could be a pre-existing thing from pre-babies. And of course, any pelvic pain, lower back pain that can be related to pregnancy or postpartum. So this includes anything around the hips, the pubic bone right at the front, pubic symphysis dysfunction, the sacrum or sacroiliac joints at the back, and then the tailbone and lower back as well. So one of the key things that sets us apart as pelvic floor physiotherapists, as opposed to your sports physios, is that we are able to assess the pelvic floor muscles internally via a vaginal exam. So during this assessment, we check the coordination of your pelvic floor muscle contraction. Are you doing it correctly? So the ability to squeeze and relax the muscles, the strength and endurance of those muscles, the tone or tightness of the muscles, as well as any sensory changes or determining any prolapse or risks that might affect birth or exercise choices. I know that the internal exam is not everyone's cup of tea, and that is totally okay. There is a lot that we can still guide you on and assess based on specific questions that we ask about your symptoms or your history. But if you do feel comfortable with that pelvic floor assessment, whether it's on the first visit or maybe a bit later on when you're feeling ready, it is considered the gold standard of pelvic floor assessment, which gives a more accurate assessment than ultrasound, for example. And that lets us know exactly what's going on with your muscles, what's going on with any prolapse or concerns. So what do we really need to do to resolve any of your symptoms or anything that we need to work on specifically leading up to giving birth.